Continuous learning.
క్రియాకలాపాలు
Being
ఒకటి ఇప్పుడు good afternoon everyone. In last class we will see radiation biology and effects on the organ. So this is a diagrammatic representation of our body where you can see all the structures organ in the body, and now we will see how it will affect, how the organs will be affected due to radiations. So some organs are relatively radio sensitive, like high radio sensitive, intermediate, and low. So highly sensitive organs are lymphoid organs, bone marrow, where the RBCs will produce testes, intestines, mucous membrane. And intermediate radiosensitive organs to the radiations are fine vasculature, growing cartilage, growing bone, salivary glands, lungs, kidney, and the liver. And the low radiosensitive organs are optic lenses, mature erythrocytes, muscle cells, and neurons. So the neuron cells are the less effective, whereas the mucous membrane, oral cavity, is highly radiosensitive to the radiations. So that we have to see how the radiation will affect on the oral cavity. In the oral mucosa, on the taste bud, and how the salivary glands will be affected due to the radiation teeth, and the bone, how it will be affected due to radiations. This is the diagrammatic presentation, and see the clinical picture of the oral mucosa, the patient undergoing radiation therapy. Here you can see there is no papillation, depapillation of the tongue. We are not seeing any papillae, and the tongue is soft, reddish in the color, and palate, you can see the paleness is seen on the palate, yellowness you can see. The buccal mucosa is erythematous, and ulceration you can see here, and there are fibrous bands. The patient's mouth opening is also reduced. These are the side effects of the oral radiations. So in the early stage, you can see the redness and inflammation and breakdown of irritated mucous membrane, and this is why there is more chances of secondary infection like candidiasis infection. And in the late stage, what will happen after the 3 to 7 weeks of the radiation therapy, you will see there is a rapid healing of the mucous membrane, and mucosa becomes thin, atrophic, avascular, and you may see ulceration due to denture. So the patient will be having difficulty in wearing denture, complete denture. This is the histopathological picture where you can see the epithelial lining in the oral cavity, epithelial layer, and this is the fibroblast, macrophages, and capillaries. You can see in the above picture. And after radiation, in the next image, you can see the radiation will go inside the epithelium, and it affect epithelial layer to protect the layer. The macrophages will come in front towards the epithelium to heal the area, and there will be cellular damage in the vascular layer, in the capillary layer. You can see the damage, DNA damage, apoptosis, programmed cell death. We see in the capillary phase. So the treatment, first ask the history, then diagnosis, and then go for the treatment plan. Like oral rinse, salt and soda, rinsing with you. Tell the patient to rinse whole mouth for 8 to 10 times daily. And selective oral fluoride inhibitor lozenge is given with polymyxin E, promomycin, or amphotericin B 4 times a day. Then discourage the patient to wear the denture because it will irritate the oral mucosa and leads to more ulceration in the oral cavity. Then give sucralfate suspension or viscous lignocaine application in the oral cavity for the pain relief. Lignocaine is anesthetic agent, so it will reduces the pain and inflammation. Salivary substitute salivary will be given if the patient is complaining of dryness of oral cavity. Next, we will see how the test buds will be affected. These are the hair-like filament picture of the test buds. These are the test cells and supporting cells, and these are the basal cells. So, here, after radiation therapy, there will be the extensive degeneration of the test bud, and patient will lose the test sensation. Like in the last class, I told anterior two-third is supplied by um, it will give the salt and sweet taste. It will be affected and the patient will be having no sensation while he is taking salt and sweet substances. Next we will see the salivary glands. This is the picture of salivary glands. Everybody knows this. Below the ear you will see the parotid gland, which will have the duct called as Stenson's duct, and this is submandibular gland, which is situated in the lingual aspect of mandible and sublingual gland, and the minor salivary glands, which is present on the floor of the mouth. So all these glands will be affected, and the, there will be the progressive loss of salivary secretion after radiation. Patient may complain of dryness of the mouth. Yes, there is more chances of xerostomia. pH will fall, and saliva will be more thick and viscous, so that patient will be having difficulty in swallowing, and this all will be due to Streptococcus lactobacilli and Candida uh, bacteria. So there is more chances of secondary infection like Candida, um, Candida growth will be there, and patient might be suffering from candidiasis. Fibrosis, adiposis, and loss of vasculature, parenchymal degeneration also we see in the cavity. And coming to the management, we give the salivary juice like pilocarpine to increase the salivary secretion. Since the saliva has gone down, we have to increase the salivary flow to reduce the caries formation. And so the salivary juice, this will increases the salivary secretion like pilocarpine and simulin. Then oral rinse can be given. Mouthwashes you can give Chlorhexidine. Uh, then salivary substitute mucin containing lozenge also we can give here. Now coming to the tooth, how it will be affected, I have told in the last previous class, which is before the beginning of calcification, if the radiation will be affected, it will inhibit the cellular differentiation, malformation will be there, arrested general growth, retarded root development, dot to failure to form one or more root or premature eruption. You may see if the radiation affect before the calcification. And after the calcification means after the pupil has developed, after the whole crown has developed, and then the patient undergone the radiation therapy, then you will see the radiation series. This will be asked for 5 mark question, for 2 mark question, radiation theories. So this is the clinical exam, clinical picture of the radiation caries, where you can see generalized caries formation on the cervical region, circumferentially. You may see the blackish discoloration over on the cervical skin. Superficial smooth caries or cervical caries and pigmentation. You may see it on all the tooth in the radiation caries. How it will be prevented? By applying fluoride, topical fluorides like sodium fluoride gel, every second day mucus mesh gel, or fluoride carriers, or the plaque control like rinses will be given. Like fluoridase excellent rinse mouthwashes will be given in the patient to prevent the further caries formation. Next is the bone destruction of osteoclast and osteoblast. This is histopathological structure of the bone, where you can see the structure, hematopoietic stem cells, stromal stem cells, and this there will be replacement of normal bone in the fatty and fibrous matter. Since the bone density is reduced, it causes the necrosis of bone due to hypovascularization, hypoxia, less oxygen, hypocellular marrow. Entropic endosteum, you can see, decreases the degree of mineralization. Now bone will be more brittle and there is more tendency to the fracture and infection. Acute radiation syndrome, radiation carcinogenesis, and genetic effect. Next, we will see the acute radiation syndrome. It's the collection of signs and symptoms experienced by the person when the whole body get exposed to the radiations. So, for that, some animal experiments has been done or the human exposure following the medical radiation therapy has been assessed, and the patient, the people who undergo that abuse blast, that patient has evaluated and radiation accelerators. That is how we have understood whole body exposure. So acute radiation syndrome, it will be having prodromal period. When the phase it will be having first it will be prodromal period. We need 2 hours after the radiation is got exposed to the body. So what you will see in the prodromal period, the patient will feel nausea, vomiting, diarrhea, weakness, anorexia, and fatigue. Then in the latent phase, no signs and symptoms occurs. During this phase group, it is dose related. Hours to days it is supralethal exposure, and for few weeks it is sublethal exposure. Next is hematopoietic syndromes. Hematopoietic stem cells of the bone marrow and the spleen. The circulating granulocytes, platelet erythrocytes will be affected. So you will see the decrease in the count, decrease in the granulocytic count, platelet count, and erythrocytic count. So you will see the leukopenia, thrombocytopenia, and anemia. If the GIT level is irradiated to the radiations, so it is exceed than 7 to 15 virus, you will see the epithelial loss of epithelial cells in the intestinal mucosa. So there will be ulceration and hemorrhage in the intestine. If it is get irradiated. So the patient will feels diarrhea, dehydration, loss of weight, and the region will be more septic for bacteria, septicemia, bacterial septicemia will be seen. Then how the cardiovascular and central nervous systems will be affected. We will see if the radiation is more than 10 15 varies, as related to CNS and CBS, patient, the collapse of circulatory system will happen, and there will be fall of BP in hours to proceed to death, and necrosis of the cardiac muscles. There will be intermittent stupors and incoordination emergence you may see. And coming to the radiation carcinogenesis. Carcinogenesis is a cancer formation. Cancer by modifying the DNA or the gene mutation. Susceptibility of the different tissue to the radiation-induced cancer is divided into the high, moderate, and low. High includes colon, stomach, lungs, bone marrow. Moderate includes breast, esophagus, low, bladder, liver, thyroid, skin, brain, salivary glands. So the carcinogenesis causes a cancer by modifying DNA. Mechanism is the radiation-induced gene mutation. Radiation acts as initiator or the promoter, stimulating the cells to multiply, and finally it converts into the pre-malignant cells to the malignant one. For example, leukemia, it is incidence of leukemia is rises after exposure of bone marrow because of radiation. Leukemia appears sooner after than the solid tumors because of high rate of cell divisions and differentiation of hematopoietic stem cells. Person younger than 20 years of the age are more in the risk of the leukemia. Thyroid cancer, the incidence is increases after the exposure, and susceptibility is increased in childhood. Female is 2 to 3 times more susceptible to the thyroid cancer and to the esophagus cancer. If the patient is exposed to the radiation, brain and nervous system is exposed. Patient exposed to the diagnostic X-rays during examination in the utero or to therapeutic doses in the childhood or in the adult shows the excess number of malignant on the there is more chances to form the malignant